Now, DR Congo health officials first announced that there was an outbreak of the highly contagious Ebola virus in Bas-Uele province, an equatorial forest zone near the Central African Republic, back in May. The regional director for the World Health Organization, Matshidiso Moeti, says the government's speedy reaction to the outbreak helped prevent the spread of the disease.
I think what happened in the DRC is a good example of what we'd like to see happening in all of our countries. First, the government was very proactive. As soon as they were able to establish that there were positive blood tests from people who had fallen sick, they declared this outbreak. This is what we'd like to see. It enabled us, as WHO, to quickly mobilize our partners, mobilize our own capacity to go and help them, working in a coordinated way on the investigation and then on the response to this outbreak. In a way, it's fortunate that this outbreak was happening in a very remote part of the country in the DRC, so that's quite different from what we saw in West Africa spread in urban areas where people are living so in such close proximity to each other. However, it was a challenging area to work because of its isolation, no roads, so transporting people, the materials, the equipment, supplies needed was a big challenge. But we saw a very good mobilization of the central government, the minister, the partners, different development partners, NGOs, and then the local government. The governor got going very quickly. He mobilized the community. There was good communication with people, and the technical experts were put in place. We managed to put a mobile laboratory in place because it's a remote area without good health infrastructure, so as to carry out the diagnosis in the DRC. So for me, that was an extremely good example of government leadership, quick action, both local and central level partners who were ready to jump in, and facilitation and good partnership to really deliver a strong response.